If you wake up each and every morning with a dry mouth, do not immediately reach for a glass of water just yet. Tonight, before you climb into bed, there is one straightforward thing I want you to do that has the genuine potential to completely transform how you feel when you open your eyes tomorrow morning. But first, you need to truly understand why this is actually happening to you, because the real reason may genuinely catch you off guard. Most people automatically assume that a dry mouth simply means they are dehydrated, but in a great many cases, that assumption is not accurate at all. In fact, waking up with a dry mouth may actually be your body's very first warning signal that something significant is occurring while you are sleeping, and that deserves your serious and immediate attention. So here is my question for you. When you wake up in the morning, is your tongue sticking to the roof of your mouth? Are your lips cracked and uncomfortable? Is your throat feeling parched and dry? Or do you find that you absolutely need water before you are even capable of speaking properly? If any of this sounds familiar, your body is actively trying to communicate something important to you, and I want you to truly hear this. Saliva is one of the most extraordinary and remarkable fluids produced anywhere in your entire body. It actively shields your teeth from developing cavities. It neutralizes harmful and damaging acids. It keeps bacteria under control. It initiates the very first stages of digestion. It lubricates and protects your mouth and throat tissues, and it even plays a meaningful role in defending your body against infection. When saliva production consistently declines night after night, bacteria are given the opportunity to multiply rapidly. Morning breath becomes noticeably worse. Your risk of developing tooth decay and gum disease rises significantly, and the delicate tissues lining the inside of your mouth begin to deteriorate and suffer. And one of the most frequently occurring reasons this happens is mouth breathing. That is right, mouth breathing. If your nasal passages are blocked due to allergies, general congestion, sinus-related problems, or a deviated septum, your body will naturally and automatically switch to breathing through your mouth while you are asleep, allowing moisture to continuously evaporate from your mouth and throat for hours at a time throughout the night. Snoring and obstructive sleep apnea make this situation significantly worse, and a large number of people who actually have sleep apnea have absolutely no awareness of it until telltale symptoms like persistent dry mouth, morning headaches, excessive daytime fatigue, or loud snoring eventually prompt them to seek a proper evaluation. But there are also hundreds of commonly used medications that can significantly reduce saliva production, including antihistamines, antidepressants, anxiety medications, blood pressure medications, muscle relaxants, and numerous over-the-counter sleep aids. Elevated blood sugar levels, diabetes, cigarette smoking, cannabis use, consuming alcohol before bed, excessive caffeine intake, chronic and ongoing stress, and certain autoimmune conditions can all contribute to this problem as well. But here is the simple and practical thing I genuinely want you to attempt tonight. Before you settle into bed, make absolutely certain that you are able to breathe comfortably and freely through your nose. If your nasal passages are blocked or congested, try using a saline rinse to clear them. Address any underlying allergies if that is appropriate for your situation, or do whatever is safe and reasonable to help you breathe more freely through your nose during sleep. This single habit alone has the potential to dramatically reduce the amount of mouth breathing you do while you sleep each night. Additionally, make a point of avoiding alcohol within a few hours of going to bed. Avoid loading up on caffeine late in the afternoon or evening, and focus on staying properly and consistently hydrated throughout the entire day, rather than attempting to make up for it by drinking large amounts of water right before bedtime. If the air in your bedroom tends to be particularly dry, seriously consider using a humidifier to introduce more moisture into your sleeping environment throughout the night. And here is something genuinely fascinating that the vast majority of people have never been told. Your salivary glands are directly regulated and controlled by your autonomic nervous system. When your body remains under chronic and persistent stress, or continues operating in that constant fight or flight activation state, saliva production can decrease quite significantly, leaving your mouth feeling dry and parched, even when you are drinking what seems like plenty of water throughout the day. Tomorrow morning, when you wake up, I want you to pay close and careful attention to how things feel. Did your mouth feel noticeably better than usual? Did you wake up feeling less thirsty than normal? Did your throat feel less irritated and raw? Those seemingly small improvements can provide genuinely important and valuable clues about what has been happening during your sleep. But if you continue waking up with severe and persistent dryness, if you or your partner notice loud snoring, if you experience choking sensations during sleep, if you are dealing with excessive and unrelenting fatigue throughout the day, unexplained weight loss, or consistently elevated blood sugar levels, please do not dismiss or ignore those signs. These symptoms absolutely deserve a thorough and proper medical evaluation from a qualified doctor. So here is my personal challenge to you. Try this one simple experiment tonight, and then come back and tell me in the comments exactly what happened for you. Did clearing and opening your nasal passages before bed actually make a noticeable difference? Did you wake up the next morning feeling genuinely better and more refreshed? Sometimes the smallest and simplest changes in our daily habits produce the most surprisingly significant and lasting results. And always carry this important truth with you. Your body almost never sends signals without a meaningful reason behind them. That dry mouth you experience every morning is not simply a minor inconvenience to be brushed aside. It may very well be your body's way of asking you to pay closer and more careful attention before what is currently a small and manageable problem gradually develops into something considerably more serious and difficult to address.